Um, so today we're going to talk about how to say what you mean, how to get heard, and how to listen better. Because these are all tools that are important when you have ADHD or when you're neurodiverse. And it's important because you want to be able to say what you want and feel like you're heard, and you want to be able to listen and let people know that you heard them. So that's great. So let's start off with my question. Do you ever wish that you could pause time, take back something you said, and do it again? Or would you like to be someone who has quick comebacks in conversations instead of thinking about um, something good that you say 10 minutes later? Okay, I'm following the directions here. All right, so I press the add button and nothing happened. Oh, maybe do I write it? All right, I'm just figuring it out here. Settings. Okay, I am now quitting on how to do this. All right. Hi, everybody. Hi, Dina. Hi, Danielle. Hi, Tina. Thank you. I did find that item. Oh, hit blank and then type your name into the comment. Hold on. Yes. Hello. There it is. Okay. Maybe that worked. I don't know, but I did it. Well, this presentation will remain here on this Facebook page. I signed up, but my daughter called me and I don't get to talk to her much. She works all the time. Yes, it will. Okay, so let's go back to my question. Do you ever feel like you've said something and you wish you could take it back? I feel that way. I'm definitely feeling that way. Oh, I'm so bright. I'm definitely feeling that way right now because of something that I said over the weekend, and I wish I could take it back, and too late for me, and now somebody's very upset. So communication can be tricky for people with ADHD. We may interrupt too much or speak too quickly. They may space out unintentionally, then miss key elements of a conversation. They may feel insecure about what they have to say as being stupid. Um, and what we want to do today is to learn some useful techniques for speaking more effectively and becoming a better listener, which can assist kids and adults with ADHD, learning disabilities, or high or level 1 autism. And this will help all of you improve interpersonal skills and reduce social anxiety. So I'm not gearing this talk towards kids or towards adults. Most of you are adults, but you may have children. So, I want you to take from it what you can and what applies to you, and then ask your questions in the chat. So we all get excited with what we're trying to say and we don't listen. Thank you, Carly. And Dot says, wow, that's me all the time. All right, so becoming a strong and empathic communicator relies on self-awareness, impulse control, emotional regulation, and working memory. Um, and so with understanding, um, you can learn, to deal with issues with cultural values, social norms, or interpersonal dynamics that you may miss or interpret inappropriately. And so that you can make changes to participate in conversations more appropriately and confidently. Now, we all make assumptions about each other, primarily that others are in complete control of their words, actions, and their emotions, and I'm not. There's a general assumption that people know the unspoken, unwritten, often mysterious rules of social engagement. These assumptions do not account for the experience of living with neurodiversity or the effects of anxiety or depression on the mind or body. Many people with ADHD, LD, or ASD, or anxiety may never have learned or understood basic social skills. Maybe you weren't taught them, or maybe you couldn't process and store them if you received the information. Instead of pointing out the deficiencies in their character, we want to take a more compassionate approach. So what are the different types of communication? There's verbal and nonverbal. And these include implicit values and explicit values about implicit values and explicit behaviors about introductions and departures, physical contact and space when speaking, texting versus talking, how to meet and greet someone, and physical contact, and much more. So what are some verbal tips? So let's talk about how to join a conversation, participate in it, and leave. So the first thing that we want to do is we want to ask if we can join a conversation. Is this private? Can I join you? Because you don't know, if you just plop yourself down, you may or may not be wanted. So what we want to do is to ask if we can join and then listen. Listen to what's being talked about so that you can get a sense of what's happening. And this is especially important for people with ADHD because you want to get a sense of what's happening verbally and you want to get a sense of what's happening emotionally. You're trying to take the temperature on the conversation. Then when you've done that, you're ready to participate. So we want to be genuine and avoid trying to say or do something that's based in your anxiety to measure up and fit in. So good listening means being able to reflect back part of what you hear, which validates the other person so they feel heard. So you might want to use a mirroring statement such as, oh, so what you're saying is blah, blah, blah. Or a summarizing statement, oh, wow, you just got that new job. Fantastic. This reflection back to the other person helps compensate for wandering attention also because you are sharing some of the ideas you've heard, even if you've missed others. So we want to ask questions in a conversation without conducting an interview, so you're not dominating the conversation. We also want to avoid judgments or minimizing someone else's concerns or experiences. If you miss something because you become distracted, you come back to the conversation and you don't know what's going on. It's easy to say, what's happening? What did I, why, well, start asking questions. What we want to do instead of saying what, which shows that you missed something and you spaced out, instead we want to either have a friend there to say, what were they talking about? What are they talking about? Or just pause and track the conversation so you get what's going on. When it's time to leave the conversation, we don't want to just get up and leave, right? We want to say something about needing to leave. Great to see you again. I gotta run. See you soon. So you're exiting rather than just getting up and leaving. So this is all about how to join a conversation and be part of it. So I'd love to hear from you. What part of any of those three tasks is challenging for you? Asking to join a conversation, participating by being genuine and listening with reflection, or exiting a conversation gracefully. Where do you struggle? So let's have you put some comments up in the chat because I'm very curious where some of you may struggle in your conversational abilities. Okay, I don't see any comments yet, so I'm just hoping that, that you guys will add. And all three, okay. So I'd love to hear from you a little bit about what the challenges are. Bonnie, asking questions without interviewing people, question mark. So it's hard. I think what I mean by that is, when you're interviewing someone, your goal is on asking your question, not necessarily from a place of curiosity and listening to their response. And we don't want to ask questions over and over again because that's not a conversation, right? A conversation is a give and take. Sanjay says, speaking too long. That does happen for a lot of people with ADHD, is that you're so excited about something and you're talking about it, but you don't realize that the person, that the like shades went down and they're not listening anymore. Tina says all the things you said. Susan, I don't say much, not in many conversations. Right, and so that may be the way that some of you compensate for your nervousness in conversations is you just don't say anything. Aziza says, sometimes judging if a pause is real a pause or the other person is just thinking before I jump in. Thank you so much for saying that, Aziza. I think that is so important. It's hard to know if it is a pause, you know, if they're taking a breath or whatever, or if they're just waiting for you to finish. And I think that's something that a lot of people with ADHD and without struggle. Um, let's see, Dale says, wanting to go back to an earlier part of the conversation after everyone has moved on. Right, so that's sort of part of your processing speed, right? You're still thinking about something that's, you know, 2 paragraphs ago, but it's interesting to you. How do you go back to that part of the conversation? You say, you know, you said this thing a few minutes ago that really interested me. Could we go back to it? Rather than just immediately going back to it and not kind of slowly making your way there. Hold on a second. Okay, Dot, I know what you mean, but everyone says I'm interviewing them, interrupting them. So maybe, Dot, what we want to do is ask fewer questions. Like basically say, in this conversation, I'm going to limit myself to 3 questions, and notice when you're doing that. Daniel says, when conversation loses my attention, I want to jump to another conversation in a group meeting, partying or networking. So yes, and so what happens is that sometimes you can jump in a way that can be offensive to the other people. Let's see what else we got here. Okay, entering a group combo is tough. Filling every pause in a class or group. So feeling uncomfortable with a pause and like you have to fill it up. I'm curious what you're thinking about that is, Tina. What is uncomfortable about the pause that you have to fill it up? And most people don't really have to think about this at all. I might disagree with you on that, Anne. I think actually people do think about this because people with and without ADHD can be interrupters, can be loud talkers, can be soft talkers, can be long talkers. I mean, there's that very famous Seinfeld episode where they talk about the long talkers and the quiet talkers and the low talkers, I think they call it. It's very funny. So I do think that actually people do think about it and they're aware of it. Claire, my daughter struggles to engage in conversation authentically. She struggles to follow the to and fro, favoring to dominate and control the flow. So that's actually called tracking a conversation. And so when people with ADHD in particular have slower processing speed, they struggle to track the conversation. So they try to control it. So at least they know where things are going and what's happening. Marianne, I cannot stop myself from interrupting or chiming in, even if it's not the right moment to speak. I also get stuck on the prior topic. So part of what I'm hearing from a lot of you is a difficulty with impulse control. Let's see, Ames. I tend to make sound effects when there is dead air. I don't even notice. Okay. That actually I'm guessing you're smiling when you say that because that is kind of funny. And although it's not funny because other people think, wow, what are those strange sound effects? Claire says she comes across as dominant and overpowering. Yeah, Claire, I'd want to know for your daughter, like what is uncomfortable about when she struggles with the to and fro. Could she have a friend in the conversation assist her, or just accept that, you know, she's going to focus on a few things in a conversation? Because by coming across dominant and overpowering, she's probably alienating some people. Ames, because I don't like the awkward silence. I see. So the silence feels awkward, so you don't want to have it there, so you want to fill it up. Sanjay, I physically put my finger or hold a pen against my lips, so speaking takes an additional intentional action. Okay, wow, that's intense. Okay. Does that work for you, Sanjay? I'm curious. Dot says, you're welcome. Dana, I hear everything when not wanting to. I will comment on my coworkers' conversation that they are having. Right, and that probably feels intrusive to them and a little creepy. So either join the conversation or don't join the conversation, and maybe consider like earplugs or headphones or something. I see, to prevent interruption. Okay. All right. I got that. Okay. Tina, you said, okay, Tina, not allowing a conversation partner to finish a sentence, anticipating their next word. And that's probably frustrating for you and for them. All right. To have the last word without noticing it. You want to have the last word. What do you think that's about, Dana? What is it in having the last word? Like you're not noticing that you're trying to have the last word, but you are, so you must have some awareness. Aziza, trying to be concise. My thoughts are fast, mixed with perfectionism, so I sometimes go on a tangent, stumbling or outwardly looking slow or frozen because I'm trying to choose the best word. So that actually also again speaks um, to this processing speed issue, that information is coming in, you want to do exactly the right thing, and you can't process as quickly. Ames, I'm always focusing on make eye contact, ask questions, don't talk about yourself when people are talking to me, so I'm not fully taking in what they are actually saying. So I'm curious, Ames, who taught you how to do that? And if that's not really helping you, what would you like to do instead? Because I think if you're focusing on that, then you're not listening, and then people may not feel actually that they're having a genuine conversation with you. And plus, it doesn't sound like it's super satisfying for you either, that you're kind of preoccupied with what you should be saying. Dot, in professional settings, I find myself struggling when I hear words that I'm not familiar with or understand. Maybe, Dot, you could write those words down and then look them up later. Sanjay, I can't process paragraphs of ideas. I need to understand each sentence individually. Jotting down notes can be distracting too. That sounds very frustrating. Asking to have jargon explained is okay. I agree, Dale. Ames, I'm always thinking to myself, make eye contact. Right, okay. Tina, I have a style which is cultural in my case, but mine is exaggerated. Teaching all of this intuitive, trying to teach all of this intuitive stuff to my ADHDer. So some of this is intuitive and some of this is actually instructional, and it takes time and practice. Renzo, I've been told to make faces at people and they think I'm angry with them. I'm curious about that, Renzo. Who told you to do that and what kind of faces? Dana, I notice after the fact and have noticed my brothers the same way. I see. So you're not trying to do that, but it's happening. Have a naturally flowing conversation and not have to think about whether or not I'm being normal or not. So one of the things, Ames, that you're describing is something that I actually want to talk about, and I'm going to get to that in a minute, which is the self-criticism piece, because you're outside of yourself, judging yourself. Like it's what I call the double craziness. Like you are outside yourself, judging yourself in what you think other people may be thinking about you, but there's no actual proof of that, and we don't know if that's true or not. So I think it's important to forget about normalcy and just focus on presence, because when you're focusing on being normal, you're actually not present, and that makes you seem not normal, right? You want to focus on presence instead. Claire, at 15, she lost all her friends. Oh, God. And has been isolated until recently. She just started college. Wow. And is trying to build relationships with new peers and friends. Her communication, is a huge barrier. So she's very controlling and fixed in her beliefs. So we have to use specific scripts to remind her it's okay for us to disagree. It's okay for us to see things differently. My sense that I get, Claire, is that this is just going to take practice for her. And that under that need for control is a great deal of fear of rejection. All right, so I'm going to pause and go back to some of the things that I was talking about so I can make sure we get them all. So the second thing in speaking is pacing yourself. Watch out for talking too slowly or too quickly. Check out other people's facial reactions. One thing that can be problematic is giving directions, kind of like what Claire's talking about her daughter, giving directives instead of offering suggestions. No one really wants to be told what to do. It may be useful to wonder about a way of doing something different instead of telling someone what they should do or how they should act differently. So we want to try to open the conversation rather than keep it closed. Now, there's also nonverbal communication. So this is in terms of body language and facial expressions. There's interest and engagement looks open and calm. There's a relaxed posture, eye contact, you're leaning forward, you're interested. Judgment and discomfort look more closed, crossed arms and legs, looking away. Physical proximity. What are the cultural norms around physical proximity in the place where you live? In our culture in the United States, it's about 3 feet, which is about your arm's length when you're standing talking to someone. But some people are more comfortable standing closer. With COVID, people are generally not as comfortable standing closer. And you want to keep your hands and your body parts to yourself without permission. Some people are just naturally kind of touchy, but other people really don't like to be touched at all. And so if you don't know, it's good to ask, you know, can I tap you on the shoulder, or you can tap them, and if you notice that they shrink back, you've gotten that that's not the right thing to do. There's also volume. How are people speaking? Are you speaking louder or quieter than other people? Can you hear yourself? Do you have a buddy who can signal if you're off? What is your tone of your voice? What's the music in what you're saying and communicating? And finally, movements. Body movements can be distracting or off-putting to others. So we want to let people know that your body may do things that you're not aware of. If you have Tourette's, or you just have, you just may move a lot. It's not about them, it's about you. So let's go back to some of these comments. Stacy, saying that you know how they feel, or replying that that the same thing is happening to you, etc. I think it looks like I'm making conversation about me, but I'm trying to relate and let them know I understand about them. That seems okay, as long as it's not that you don't keep doing that more and more. Dot, please share more on the processing speed, because I struggle with being able to keep up with others. Then others will put words in my mouth that are wrong. So I think in that moment, what you need to say is, it takes me a little while to get my thoughts out. So can you just be patient, or take a deep breath, or something like that? What about teaching people how to communicate with me, knowing that everyone is not excellent communicators despite what they believe? I think that's fine if people are close to you and they want to learn that, particularly if you have a boss who wants to work with you, or some friends, or a partner. This is how I can communicate best. I think that's a great idea. I like that, because not everyone is an excellent communicator. And I think if you're able to take the lead on what works for you, then that takes some of the pressure off. Okay, Dana, starting not to talk as much because I can't have simple conversation. It makes me late to things. I get too deep into the conversations. Plus, when I talk too long, there are a lot of squirrels in my conversations. Well, that's actually really helpful to know about yourself. Maybe to just try to keep things to 2 or 3 sentences and then pause. I don't think that's necessarily a terrible thing. In fact, I think you can get into a deeper conversation when there's time and someone who understands that you're going to see a lot of squirrels and shiny objects. Dot, I have to watch that telling people what to do. Yeah, that's not something people like that much. Dale, I'm a slow talker. I always thought it was because I was a hick from the sticks. No. Latinos have super close proximity. Yes, some do. And again, we want to operate in the proximity in what is culturally normative. Dana, I'm always watching the other person's body language and facial expressions. That's important. Carly, oh my God, I always tell. Yeah, I don't hear it, but people tell me it's cultural, though. These are great ideas. I'm so glad you're here. Good. Sharon, I do too, Dana. If I need to call someone and ask a quick yes or no question, I have to wait till I can have about 30 minutes time, because we always end up talking and communing instead of short and sweet, get the job done. If I really can't spare the time right then, but I have to have an answer from them. I beg him to make the call. Okay. You also could use a timer, basically, and give yourself a little notice, like have set the timer for 10 minutes, and at 5 minutes get a warning, something like that. When you stress, TS can kick in, and that's not what works once. What's TS, Lee? Renzo. So when I'm with my friend, she is reading my facial expressions, and she thinks I'm upset at something she has said, and gets the wrong idea of my facial cues, and I have problems being aware of that. Some people have a resting face that doesn't actually reflect what's going on in front of them, and going on inside of them, excuse me. And I think that's worth talking about that with her, that instead of assuming how I'm feeling by how I look, it would be better to ask me, because my face and how I feel are not necessarily connected. Tina, some of these issues have caused and continue to cause problems in my marriage. My former and current long marriage are intercultural. I can see that would be challenging. Margaret, I love timers when I remember to use them. Yes. Okay, so I guess what I'd like to hear a little bit from you is what parts of conversations do you think you're good at? That would be really helpful. What parts of conversations do you think you're good at? Because a lot of you actually want to communicate with people, and are trying to communicate with people, but you're telling me the things that you're not doing well. What are you doing well? Because I always think it's important to magnify what's going well, and then we can work on some other things. Okay, hold on a second. I'm getting a message that the frame rate is too low. I'm going to ignore that. Okay. Ziza, over-explaining myself for fear of being understood or due to mind reading people's expressions, especially if they look like they're lost interest or frowning, but sometimes backfires as they might think I think they don't understand. Okay. Humor sometimes. All right, that's good, Tina. Lee, talking on the computer and tech and math. Great. Margaret, humor. Anybody else? What are some of your strengths? Dale, I'm funny, but that does not go over well in serious conversations. Yeah, if they're having a serious conversation, it's not a time to make a joke. Actual knowledge when not being oppressive with it. So how you can actually sort of dilute your knowledge or spread it out rather than try to give it all at the same time. All right, well, I'd love to hear some other ways that people feel like they do well in conversation. So I came up with a little acronym for today, and I'm going to put it in the chat. It's called APPLE. An apple a day. So here it is, APPLE. And this is what it is. The first one is ask to join. So we want to ask relevant questions. We want to assess what's happening by looking at people's faces, and we want to ask to join conversations. The P, physical proximity and volume. Place yourself appropriately near others. Observe their volume and their pace and do the same. Participate with reflective statements that show you're listening. Show genuine curiosity about others' experiences and avoid judgments. L, lay off the self-criticism. Turn down the volume on the internal negative voice that guesses what other people are saying about you because it's often wrong. Stay present and engaged with what's happening now. And finally, E, enjoy connecting with others and sharing what's special and fun about you while receiving what's interesting and compelling about them. Conversations and communication is about give and take. So let's go back and see what I'm hearing. So Lee says, I try to take what I do good and take it to and work to where I need to do it better. I'm good at smart and grasp, but that's both good and bad. Aziza, I'm an empath, so people find it easy to talk to me. I'm also told I'm a deep person. I like that. That's great. Dana, I love to listen and learn about people, but I probably ask too many questions. You know, again, I think with the question thing, it's good to ask, um, excuse me, not about you guys. Didn't sleep too much last night. Um, love to listen and ask, but ask too many questions. How much is too many questions? Like, how do you know you're asking too many questions? I think, you know, if you're in a conversation and they speak and you ask a question and then they answer and then they ask you a question, you know, think about, well, in this conversation, I want to ask 4 or 5 questions. That's maximum. And then pay attention to how many, if you can, you're asking. Maybe use your fingers, like 1 is a thumb, 2 is a pointer, 3 is a middle, and say, okay, that was a 1. You know, really just try to keep track. And I think that's one of the challenges with being able to have conversations when you have ADHD is that tracking function, tracking what people are saying to each other, tracking where your thoughts are and what you're doing, and being able to juggle all of that information in your brain. Lee says, when I map what I'm going or trying to do or learn, if I cannot map, well, I'm not going to go A++. The second P. Okay, so would you like me to repeat the Apple acronym? Yes. I'm going to put this in the chat. So we have A, which is ask to join, ask relevant questions. I'm just going to say questions, and assess what's happening. And you want to assess what's happening by really taking in the information around you rather than what you think is happening, okay? So that's the first one. And the first P is physical proximity, okay? Sorry, I'm typing and talking. It's a little challenging. And volume, okay? The next P is participate. Participate with reflective statements and show genuine curiosity. Curiosity without judgment. It's the judgment that can really get you in trouble. The next one is to lay off self-criticism. Hold on. Criticism. Annie's not here today, so I'm on my own, which is why you're dealing with me typing and everything. And enjoy connecting, okay? Give and take. All right, so there we go. Great. So I'd like to hear from you a little bit about, you know, in this Apple acronym, and this Apple acronym, this is going to be in my blog next week. So make sure you go to my website and you sign up for my blog. So check it out. Okay, so I'd like to hear from you, you know, of this, these different ask, physical proximity, participate with reflective statements, lay off self-criticism, and enjoy using a give and take. What do you where do you think you're going to really soar, and where do you expect that you're going to hit some bumps? So ask, physical proximity, participate with reflective statements, lay off self-criticism, and enjoy the connection. Dot says, I was able to discuss complex topics and break things down in the manner in which it was said or done without the person being direct, i.e. you make a request for something, the person doesn't answer you, but they give you a song and dance, which ultimately is a no. Good for you. I like that you can actually basically be able to break down complex things. That's a gift. A lot of people can't do it today. How about the rest of you? What are some of the things in the Apple acronym that you're good at? What part do you think you're good at? Where do you think you might struggle or stumble? Anybody? Does anyone might have trouble with the laying off the self-criticism? And if so, in what way? What's it like to connect with others? Is that something you want to do or you feel like you should do? So I'm curious to see what some of these responses are. Margaret says, I'll enjoy, but I'll have a difficult time with the participation because my mind checks out within a few seconds after the other person starts talking. Well, that's really interesting, Margaret. What do you think would help you check in? Like if you focus on their face, does that help you? If you look at the forehead here or their earrings, what helps you with being able to stay checked in? Okay. Let's see. Show genuine curiosity. E is for the enjoy is tricky for me. I put a lot of pressure on myself. What kind of pressure do you put on yourself, Trisha? What are you expecting from yourself in these social interactions? Because it sounds to me like it's not a it might be a little bit unreasonable and unachievable. Let's see. Okay, hold on. Dale, once I warm up, participate is 5 stars because I'm a very curious person. Awesome. Elbow. Hi, elbow tap to you. Saying anything, even hard to start. So Susan, I think when it's so hard to start a conversation, the best thing that you can do is to start with very basic things. Hi, how are you? Listen to them, reflect what they hear, wait for them to ask you a question. Slow it down, way down, and keep it very basic. The goal here is for you to feel a little more confident, not to be, the world's, most fabulous extrovert. Dot, I'm going to work on ask and self-criticism, saying I'm sorry, I'm taking too much of your time. I think that's great, Dot, because, you're taking the time you're taking, and they can say I'm done. Like, why is it up to us, particularly women, to be sorry for the questions that we have or what we're doing? If someone doesn't want to listen to you or doesn't want to talk, they can say, I think we're done here. Aziza, I can ruminate over past convos even though I can't change it. Yeah, so that's something that people do with ADHD. They're really good. They just go over the past conversations over and over and wish they could have said this or that. And some of that is regret and some of that is shame. Nonetheless, what all you can do from that experience is hope that the next time you do it differently. Tina, on a good day, I can do much of this. On an anxious day, or if I feel intimidated, I will fail at much of it. I hear that, Tina. So what I think would be great is on an anxious day, which of these one is going to be your go-to that I'm going to work on? Just pick one, because you can't do all of them if you're having an anxious day. So just pick one. Diane, I have trouble with other people that interrupt. I have to bite my tongue to be polite. What do you say when they're interrupting? I'm curious, Diane. Dana, I used to be critical until I started taking my ADHD medication. Great, Dana. Trish, the pressure is to make things go smoothly and not awkward. So I'm curious, Trisha. Let's say that things are awkward. What happens for you? Like, why is it up to you to make things go smoothly and not be awkward? And if it is awkward, what does that mean exactly? If there's a silence, it may be awkward, it may not. People may just be taking it in, thinking about it. Margaret says purposeful focus. Dale, lay off the self-critic. I can wonder for days if I was a doorknob in a group setting. Okay, so that's kind of like what someone else was saying. Who was it? Let me look up here. Aziza. So we've got to cut ourselves a little bit of slack. Okay, I love the ALSUP. The ALSUP is excellent. Let's see. Oops, I missed a bunch here. Sorry. Sarissa Brown, I so needed this topic today. I've been following the collaborative problem solving by Ross Green. He has some amazing worksheets to facilitate understanding kids with lagging skills that make communication hard for kids and adults. Yes, he's fabulous. His work is fabulous. Lee, is it good to connect? It's good to connect with other people, but it's better than to try to get me and not ones that see me as not smart enough. But if they do see me as smart, I do not need to get over that. It's more what they need to do. I have nothing to get over for being me. No, you don't, Lee. You really don't. Yes, I love the ALSUP too. Medication, time of day, and topics all help me stay checked in. When someone is disingenuous, it's very difficult to stay focused. Yes, because a lot of people with ADHD, we have this really good radar and we're like, I can pick this up. Something's going on. It doesn't feel right to me. But if we say that, we could get ourselves in more trouble. I'm glad you think people can exercise agency and Sarissa, how do I be reflective when their thought process is way off base from the current issue? I would just say something like, you know what, it seems like we've wandered away from the topic we were talking about. Let's turn back to the topic and we can come back to this wandered topic a little bit later. I'll write it down if that would be helpful. Let's see. All right. Over texting, am I the only one? Diane asks, I say that I was trying to say something in a kind of rude way. I see. So I guess it's not up to me to make things go smoothly. No, Trisha, no. There's only one person you're in charge of, and that's you. So you can handle it yourself. But if a conversation doesn't go smoothly, 50% of that conversation, if you're with one person, is that person. And if there's a group, then it's all divided. Aziza, sorry talking too much. Any tips on how to converse in a group setting, e.g. multilingual family of highly sensitive people, people with RSD, or can feel like every word carries weight and misinterpretation? Aziza, that's an excellent question. And I think what we want to think about in situations like this is giving people the benefit of the doubt. Like everybody needs to zoom out a little bit. And instead of take something immediately as on its face value and respond to it, to wait a minute and say, okay, let's see what actually that person meant. Let's listen to what else they have to say. If I gave them the benefit of the doubt, what would that be? Dale says, yes, the BS detector is strong in this one. Yes, it is strong in our field. Yes. I'm confessing, thank you, Dot, that I have a difficult time speaking with someone who has untreated ADHD because I don't like when I'm tangential, overly dramatic, talking and jumping all over the place. I'm prayerfully working on me. Good for you, Dot. That's all you can do. Prayerfully work on yourself. Bravo. Lee says, yep, I do not say what is on my mind well, deep and dig my own hole. Right, so you might need to have a lot of trust with someone before you start to reveal yourself, and that's okay. You can stay on a surface that's still connecting, but isn't too vulnerable. Trisha, I've given myself a rule not to respond to email or texts immediately. It has been very helpful. Right, particularly when you get an email or a text of someone who's upset with you, that's really a sign to actually not say or do anything yet. All right, so we've talked about a lot of things today regarding communication. We've talked about verbal tips for communication, asking to join, participating, exiting conversations, speaking, the pace of your speech, the volume, the tone of voice. We've talked about body language and facial expressions, physical proximity and volume. And we've talked about movements. Like if you have a tic disorder, if you know that you just need to tap your foot or move, maybe just tell people that so they're thinking that it's so they don't think it's about them. It's just how you roll. We want to practice the Apple process, ask to join, physical proximity, participate with reflective statements, lay off self-criticism, and enjoy connecting with others. An apple a day will keep the doctor away. Super corny, but you know what I mean. All right, so I'll take a few more comments. Let's see. No, it's not unusual to overtext with ADHD. Dale says, I've started typing what I want to say to someone first before I talk to them so I don't go rogue. That makes a good amount of sense. Dot, fantastic, just what I need in this moment. Thank you all. Thank you all for coming. I want to encourage you to check out my Facebook page. I'm going to be starting a group on social anxiety for adults in January, and then a parenting group for parents of kids who struggle with anxiety as well. I hope you'll join me. So please check out my Facebook page. And if you want to see this written down in narrative form, it'll be on my blog for Wednesday, December 9th. So thank you so much. I appreciate your comments, and as usual, I appreciate so much being part of this community. Have a wonderful weekend, and I'll see you